Sink in for the belly. Face is gonna go right here.
Oh, I haven't been able to like this in a long time. Oh man, that was amazing.
She's like, what's going on out
there? Oh man, I've been waiting for that for a while. Oh, I can already tell a difference.
When we kind of flex forward.
Yeah, that's so much better. Way better than when we got here.
Sweet.
Ah, yes. He had like the gun thing and did like the tap gun thing.
Okay, perfect. Cool. Yeah, so I use Webster Technique for prenatal stuff. But
cool.
So tell me a little bit about what's going on.
So I've had lumbar issues forever. Like I said, just ever since gymnastics. I got a couple massages and I was like, all right, I can make it work. And then last Saturday, I don't know what I did. Like, I don't remember like tweaking it any sort of way, but my lumbar spine, like standing up, sitting down, like just any type of move, it was just like a sharp, intense pain.
Okay.
Called my doc because I was like, okay, what do we do for people that come in with back pain? So I was taking Tylenol around the clock, still on pause patches, ice, heat, like all that stuff, and it was barely taking the edge off of it. So she wrote me for 3 flexurals and I took 2, and that kind of got me back to a point where I can tolerate with just the Tylenol, but it still is not very fun. Okay. And then the other problem area, neck and like right underneath my right scapula and a little bit closer to the spine, that area right there. Okay.
All right, I'm just drawing a little picture right
cool.
here. Can you point to where you're feeling it in the neck?
Just kind of all over. It's always been tight.
Okay. And do you feel like that starts in the neck and goes down into the scapula?
Yeah. Okay.
And have you had that type of pain before?
Yeah.
Okay. And it's just worse of an onset now with everything going on. Okay.
Yeah.
And how many weeks pregnant are you?
34.
34. Awesome. We're getting there.
Not soon enough.
Right. All right. And then, so you've seen chiropractors before, but not with, you said, kind of the manual manipulation or do the poppings. Okay, so I'll kind of talk you through that. It's pretty light and gentle with pregnancy, especially you have, relaxin in your body, so it really doesn't take too much. And I'm going to kind of walk you through and talk you through everything. Cool. But we will run through some tests first. And we'll just take some blood pressure.
Sure.
You're good with that? Sure, that should be fine.
I was going to say, I've got an undershirt if you want me to take this one off.
Yeah, if you're comfortable with that, great. So you're keeping up with all your doctor appointments? Yeah,
I'm actually going to go see her after this. Okay. I did okay. So, I mean, not like a chiropractic issue, but I've got these like horrific varicose veins. Okay. This child is just the devil. Yeah.
Is this your first pregnancy?
Second.
Okay.
So I had them with the end of my first, but it was never this bad. Okay. So I worked all through COVID, the whole thing, and then 312s was starting to get a little tough, and then 212s was starting to get a little tough, so I'm on the floor once a week now, and then the vaccine clinic for the rest. So that's kind of a nice little switch up until...
Gotcha. All right. And everything's going well with your medical appointments?
Yeah.
Okay, good. And they're working with you on that? Okay.
Yeah, so I take 81 milligrams of aspirin every other day. Every day was causing like my gums to bleed like crazy and like bruising really bad and stuff. So we switched to every other day. Okay, gotcha.
And then do you know about how much you weigh?
Probably like 195 right now.
I know everything's probably different from day to hour to hour.
I was gonna say like normal is like 160, but I think I'm up to like 195 right now.
And then do you know about how tall you are?
5'8".
Awesome. Cool. Well, I'm going to start with kind of our next stuff, and then we'll kind of dial into the low back. Just running through a few tests. I know that you know how your body feels, and we get a lot from history, and treatment really isn't going to look too different, based on what's going on with the low back because of, how much I can realistically do. Right. We can do a lot, which is great. And these treatments typically are more of our night and day treatments, which makes
Cool.
it really fun to treat. So.
Cool. Awesome.
Let's go ahead and kind of square up on the table there. And I'm going to have you start just running through some neck ranges of motion. If you bring your chin down to your chest, do you notice any pain, pinching, or tightness?
No. Well, tight, like right about here.
Okay. And then looking all the way up towards the sky. Any pinching in the back there?
Yeah.
Okay. Just right in the center?
Yeah.
Okay. Looking all the way to your right shoulder. And can you tuck your chin down to your chest there?
That's tight.
That's tight, good. And then over to the other side. And tucking your chin down.
And that one's tight as well.
Okay. Where do you feel that tightness?
Like right here.
Okay. And then let's go ahead and look straight ahead. We'll bring the right ear to the right shoulder.
Right about here.
Okay. And then left ear to left shoulder.
Not as bad, but same thing about right here.
Okay, cool. So good thing is it's all open angle pain, meaning it's more muscular stuff than joint stuff. But obviously the two can oftentimes be related. And then that scapular pain, you said it's below the scapula?
Yeah, so it's like right about here-ish.
Okay. And when I press in through there, that's what you're talking
Yep,
about?
right there.
Okay. Versus this side, yeah, nothing there.
Yeah, it's not nearly as bad on
Okay.
that side.
And you said you've had that in the past?
Yeah.
If you kind of protract your shoulders forward, does that aggravate that area?
Yeah.
If you retract everything back,
Much worse
Okay.
going back.
rotating just slightly over to your right
Very tight on that side.
versus the left side,
Not bad at all.
taking a big breath in.
Yeah.
Cool. So rib stuff, have you ever had that in
Yeah.
the past? Okay. So that's usually clears out pretty well with
Cool.
an adjustment. So
Awesome. I'm so excited.
I'm excited for you too. So I think that's what that is. It does seem to be two separate issues. For the neck, we're going to run through adjustments, a little bit of soft tissue, and recheck that stuff and make sure that cleared out a little bit.
Cool.
It'll be kind of, we're going to do a lot of soft tissue today.
Cool.
And kind of check in and see what that is. Let me step out real quick
You go
and
to
see
town.
what this is. All right, so low back stuff, I'm mainly just going to kind of check that with palpation and a few little
Sure.
leg checks rather than kind of having you move through a ton of different motions.
Sure.
But right now, just through history, are there any certain positions that really aggravate it?
So, sitting too long, standing too long, and then going from standing to sitting isn't as bad, but going from sitting to standing is like where I kind of get that like intense.
Okay.
And it's a little bit more to the right than just the center spine.
Okay, gotcha. And then are you doing any exercise, any movements right now?
No.
Okay, cool.
I'll take homework home though.
Okay. Well, let's go ahead and stand on up. I'm going to get the table set up for you.
Sure.
This table's awesome for prenatal stuff.
Awesome.
So,
I like a hole in everything.
right. So this will kind of sink in for the belly.
Cool.
Face is going to go right here, and if we need to adjust anything else,
Cool.
let me know. So I'll go face down.
Oh, I haven't been able to like this in a long time.
Nice. If I drop the headpiece down, is that a little bit nicer?
Yeah.
Okay. Awesome. So everything's comfortable here. I'm going to do a few leg checks and see kind of where we're at with our rotation. So I'm going to bring the legs up to here. Any issues with that?
Just a little tight in the back.
Okay. Do you feel it more so on this left side?
Yeah.
Alright, so that's where we're kind of going to direct all of our care and rotation. When I press in through here,
Yep.
more tender there versus on this side.
Yeah.
Okay. Alright, and you're comfortable laying here for a second?
Yep, absolutely.
Kind of nice to be face down for a minute.
Yes, I was like, I haven't been able to lay like this in a long time.
For your prenatal massages, did they have the prenatal setup? Or did they
No,
have
just
the other
side lying.
No. There's my old practice. We had massage therapy, and they're set up to do face down, which is really nice.
Yeah.
Got the little belly cut out. All right. Cool. So we're just gonna get straight into it. And you are familiar with adjustments?
Yeah.
Okay. So I'll kind of walk and talk you through this. This first one is just going to be a drop table technique.
Okay.
So get the camera set up over here. So it's going to make a really loud sound. The table is going to pop up where your hips are. And then all I'm going to do is a little drop like that.
Okay.
Okay. So it sounds really scary, but nice little gentle drop here.
Oh man.
Doing okay with that?
Yeah.
It just sounds scary, right?
Yeah.
So 2 more of those. Good. Okay. Nothing too crazy with that?
Nope.
Aside from the sounds. And then I'm going to have you come back and sit onto your knees. I'm going to take our belly support away. And I'm going to have you come onto your side facing this way. This will be kind of our first audible adjustment.
Okay.
Those popping sounds are just little gases
Yeah.
being released from the joint. Not necessarily our intention, it just kind of comes with
Sure.
it when we're going in the right direction.
Sure.
So I'm going to scoot you a little bit closer here. And then I'm going to take the arm here. And you can just grab onto that elbow. My hands are really cold, aren't they?
It's fine.
Okay. So we're going to do a little bit of pressure into this joint here. A little roll and a push.
Oh man, that was amazing.
Great. Let's go ahead. I'm going to have you sit up, or actually go onto your back. I'm going to play into our ligament into the front. Is it okay if I press into the belly a little
Totally.
bit? Okay. You feel there's a little bit more tension here.
Yeah.
So I'm just going to hang out with some pressure. Are you doing okay
Yep.
with that? We're just going to hang here for about a minute or 2. So all of this technique is basically designed to fix the rotation of the uterus
Cool.
between the ligaments and our adjustments.
Yep.
It works really well, and by creating that balance, that will oftentimes take out a lot of the excess pressure you're feeling from one side to the next.
Awesome.
So we'll kind of, it's mainly going to be how you feel throughout the day, just getting
Cool.
feedback from frequency, intensity, duration. Oftentimes it can be a pretty instant relief type deal.
Awesome.
So, especially with kind of the rib issues and the neck stuff.
Awesome.
So you're excited to get this little guy out of
Oh
here?
my god.
Do you guys know gender yet?
Girl.
Girl.
So I was very blessed with the easy first pregnancy, and this one has just been
Oh,
not.
that's how it typically goes.
Yeah. So I was like, easy first pregnancy, kind of a rough delivery, rough pregnancy. This one's just gonna slide out. I hope.
Yeah, that's what I always end up seeing people for their second pregnancy. 'Cause
Yeah.
they're like, yeah, first one was super easy. I can feel her moving around a little
Yeah.
bit. She's like, what's going on out
Yep.
there?
I had hiccups a while ago, or she had hiccups a while ago, and I thought that she was like seizing or something, and that really freaked me. I never had that with my first.
Okay. The trouble child.
Yeah.
How old's your first one?
3. She just turned 3.
That's a good little age.
Yeah.
Definitely pretty tight here today. Just until we get this stuff straightened out a little bit more, I'll probably want to see you on Saturday if you can get in here.
Sure. Ooh, I work Saturday. 6 to 6. What time do you close?
We're closed around, and we'll figure something out.
Okay.
We can maybe kind of squeeze you in on another time.
Okay.
I might actually just be in the office. I'm working all weekend anyway.
Okay. I was gonna say I can come in anytime on Sunday.
So just to kind of get you ahead on stuff. Alright. Cool. And then you are good right there. I'm gonna drop that down. So I'm gonna have you bring your chin to your chest. Good. Let that air out.
Oh.
Yes, that's great. And then right into your rib here. One more little push, chin to chest.
Oh man, I've been waiting for that for a while.
Go ahead. All right. That actually made me feel really good.
Yeah.
All right. Yeah, there's a lot of tension there. And you saw I didn't really even have to put too much force. I just kind of wanted to go.
Yeah.
So.
That was amazing.
So same thing with the neck. Sometimes with the neck adjustments, they just sound a little bit louder because your ear's right there.
I pop my neck anyway, so it's fine.
So we'll probably get a few more than when you do it, just because we're going right into that tension spot. Are you feeling this right here?
Yeah.
Okay.
Oh yeah.
I'm gonna hang on that spot for a second. Doing okay with pressure?
Oh yeah.
Okay. So you got all the appointments today. No headaches or anything involved with this?
No.
You've been pretty headache free throughout?
So the beginning was horrible, the first trimester, and then it kind of mellowed out a little bit.
Alright, ready to go. So we're just going to stay nice and relaxed into this hand, and I'm going to feel into the joints here. Cool, so right there, a little push. Okay. Nothing too crazy?
Nope.
Good. And same thing here.
Oh, that was good.
So I'm going to get one more a little bit lower on that right side. And same thing, I'm just going to fall back here. Can you drop this right shoulder? That was your left shoulder, wasn't it? Alright. Good. So let's recheck all of that stuff. I'm going to have you go ahead and sit on up.
I can already tell a difference.
Good. Awesome. So, our big thing with the rib, when we kind of flex forward, you felt that?
Yeah, that's so much better.
Okay.
I mean, it's still a little tight on the right side, but not like way better than when we got here.
Good. And then when we retract back?
So much better.
And then if we rotate over to the right, that was where we kind of felt that
Yep,
little...
so much better.
Sweet.
Ah, yes.
And then our neck motion, so bringing the chin down to your chest. Up
Much
towards the
better.
sky. Looking left and right.
Yeah, a lot better.
Okay, great. So you're pretty easy. Thanks for watching. If you liked the video, do me a huge favor and click on that like button below. And if you're new to the channel, I'd love to hear your feedback. Please leave a comment below and I'll make sure to respond.